What are the common signs and symptoms that you're looking for when you see a patient, when you suspect COPD, and what do you anticipate as things that are triggers to exacerbate it?
Yeah. So the initial presentation in COPD often occurs in individuals who are still smoking. I mean, in COPD, over 80% of the cases in this country, not necessarily around the world, are related to tobacco smoking. And when they're smoking, they often don't say, I'm short of breath or I have symptoms, because they know what the next response is. You need to quit smoking, and they recognize that. But also, patients often don't even recognize themselves. If they cough, they think it's a smoker's cough, and they begin withdrawing from activities rather than saying they're short of breath. They don't challenge themselves. They stop doing things. When they go to the mall, they drive around till they find a parking place right near to the door that opens rather than walking across the parking lot. And so often one of the first things you need to ask is not just, how are you doing? Are you short of breath? But what are you doing? Are you just withdrawing from activity? Are you sitting on the sofa? You're no longer golfing. You're no longer getting out with your children. You're starting not to shop on your own. And that often is the first sign. And then once it is recognized and they can no longer deny it, shortness of breath, cough, sputum production, often not all the symptoms together. Often individuals will present differently. Chest tightness. Wheezing actually isn't all that common in COPD except during flare-ups, but these are the types of classic things, chest tightness, that can be experienced in these patients.
I want to stress what Frank said, because you asked before, Neil, about spirometry, and I know we're going to come back to that, but you know, if you look at the recommendations, the repeated recommendations of the Preventative Services Task Force, they stress that spirometry is only indicated at those people who are at risk and have symptoms. And the problem with that is what Frank just said. Many people self-diagnose and self-treat. Getting old, I'm out of shape, I'm overweight, and they cut back on their activity level. So if in that 5, 6, 7, 8-minute visit you have with your primary care provider where there are multiple medical issues you need to discuss, if they ask one question about the breathing and says, how's your breathing, Frank? Frank may well say, or George, you might say, it's not bad, doc, because he's not doing anything.
So when he says it's not bad, doc, you're looking further out than he is, right, from your example. And so what are you concerned about in terms of long-term complications and then also systemic manifestation beyond just shortness of breath?
So, I can certainly give you some thoughts on that. I would stress with you, Neil, though, that it comes down, as it often does in medicine, to asking the right questions. Because if you don't ask the right questions, you're going to get the wrong answer. So a better question in how you're breathing, Jack, might be, you know, how's your breathing compared to a year ago? Can you do what you could do a year ago? Can you do what you want to do? Those sort of things give you a much broader issue and a much more to take of where you are. And as far as your question is concerned, COPD, like many chronic diseases, are associated with multiple other systemic manifestations. And I'm sure that both Frank and Maria would agree, you can't treat a patient with COPD by just treating their COPD. You have to treat the person who has their disease, because otherwise you will not get to where you need to go.
So let me ask you a question. In your clinical experience, not you personally, but what you see and what you see the fellows do and other pulmonologists and so on, are people asking, can't you do this year that you could do at our last visit? Or, you know, what have you withdrawn from? Do you think that's part of the workup yet?
Is it commonly practiced? Probably not, no. And part of it is private practitioners, primary care docs are so busy that somebody says that's not a problem, they don't dig and discover that. And so, yeah, I mean, I can't tell you how many patients that I've picked up that I know have had their disease for years and years and years. They come in with advanced level disease, and you know they had it 5 years ago. And they've been seeing primary care docs or in some cases other specialists, and it hasn't been discovered. Or they've gone to a cardiologist who focuses on their minimal coronary artery disease and doesn't recognize that they have significant COPD that needs to be treated, and maybe the primary problem that even is the reason they present to the cardiologist.